Приветствую еще раз.
Once again, good afternoon, ladies and gentlemen. Seizing this opportunity, I'd like to thank the organizers of this conference, and Alekris is one of them. And I would also like to thank Provet that contributed to
Информационного.
well as our information support partner, that's the Жизнь veterinary group. And if I may, I'd like to talk to you about the biochemical monitoring of organopathologies. On the one hand, at your poultry farms, you probably carry out blood tests or send out samples, and you get in return tables with lots of parameters. And sometimes people get confused about the need to do such tests in the poultry industry. Probably use vaccines, antibiotics as a rule of thumb. Right. However, I'd like to draw attention to the fact that at many poultry farms, they have ELISA labs. You buy a set at a price of 15 to 60,000 rubles, and you do serum assays. There are farms that spend up to 600,000 Russian rubles per month for serum assays. And of course, there is always a person who will do his or her utmost for you to spend much money on serum assays. As far as the biochemical tests are concerned, the price is 10 to 1500 Russian rubles, and you can do up to 1,000 samples. If you want to develop biochemical assays, well, actually, there are no willing volunteers who sell such tests. However, I believe that they are beneficial, and that was proven by the previous speakers. First and foremost, we can do biochemical medical tests, which are quite cheap. And we can take microplates for ELISA tests, and they cost 20 to 30 Russian rubles. And just like for ELISA tests, we can do lots of biochemical tests. So this is an entire list: albumin, calcium, magnesium, ALT, AST, triglycerides, and so on and so forth. In other words, these are the tests that you can do, but the main problem is interpreting the results. However, the price is low. Like I said, these tests are cheap, and they are not as difficult as ELISA assays or PCR. We're not talking about a large-scale biochemical analysis. We're talking about screening for organopathologies. We're talking about just 1 to 2 tests that will help you monitor the dynamics. And the well, there are a couple of light filters, 1 to 4, and they help you take into account quite a broad range of biochemical reaction results. In other words, the technique is quite simple. There are lab technicians here, and they know perfectly well what I'm talking about. But the essence is you get blood serum just like you would for an ELISA test. The requirements are basically the same. However, if you want to evaluate enzyme activity, the serum should be fresh so that you get enough antibodies, or you just freeze and unfreeze the entire sample. But you should not compare one-time frozen samples with two-time frozen samples. You put the serum in the microplate wells with the help of the dispenser, and usually you use the mono region to, in other words, you use the dispenser to put the same chemical substance into different wells, and you get such a colorful result. And some flocks might look different on the microplate, and that will help you understand what is happening at your farm. For instance, triglycerides are shown in the bright red color, and of course, that might not be as relevant at this stage, but then you will process the data and draw some conclusions. And this is something that I've been talking about at lots of conferences. The approach to the diagnosis should be as follows. The best option is to spend much money to show that your farm is not infected. You show the results to the CEO. The main benefits will be derived by the vets rather than the farm, but that would be done at the expense of the poultry farm. Then you can do screening tests, which means that you do lots of tests. For instance, a very experienced vet was working at our farm. We did not like her because we only like those who monitored, who did monitoring tests. The costs were low and the results were great. And she would bring lots of different feedstocks, and we monitored the feedstock. The survival rates were high. The quality of the feed was also high, and she would only do 10 serum tests. And if there was an outbreak, we would find something in these 10 serum tests. And being an experienced vet, she fought against such outbreaks quite successfully. And lots of ELISA sales managers would probably say that she was wrong, but this, like I said, the survival rate at her farm was high. Screening tests is not something that everyone is prepared to do because you might come across some infection that you have never seen, and you will be punished by your CEO. If something bad happens, you'll see that this infection range had nothing to do with that. At the worst case scenario, you would just freeze the serum test, and oftentimes the cost of a freezer might considerably be lower than an ELISA test price. And association test is something that you can do as well. For instance, when you compare a sick bird with a healthy bird from the same hen house, and if the weight of the sick bird is lower, you compare it with that of the healthy bird, and you see perfectly well that, for instance, the infection norm is 20% for the Mark's disease, and it's 80% for the slaughter hens with the dermatitis. But we did also PCR tests, and we did not see the link, which shows quite clearly what the infection pathogen is, or which pathogen contributes to a greater extent to this outbreak. So what I'm saying is that association tests should be used at a broader scale. For instance, you can show the price of the vaccine and the economic damages incurred. That's much better than showing to your farm manager the titer curves to demonstrate that you need to do 7 more vaccinations or inoculations against this or that infection. Let's move on. What biomarkers can we use? Like I said, I'd like to emphasize it once again. It's not suitable for treating dogs and cats, but for poultry, you can use just a couple of markers because we know what organopathologies can be a problem for a poultry farm. Oftentimes, we know what the pathogen is, and to identify the drug administration time frame or to evaluate the efficacy of a drug against an organopathology, we can use 1 or 2 biomarkers or parameters without having to send the samples to a lab. If the liver is affected, that's mycotoxicosis, and for instance, there were no mycotoxins in one of the feeds, but the mortality was high at the farm, and we compared the feed from this farm with that of other farms, and we saw that the albumin was quite low. All of the other parameters were perfectly well, but just you have to remember that mycotoxins are at a lower level. ALT is another important biomarker, and I guess Provet that sells the relevant drug would correct me if I'm wrong. You do sell Litox, don't you? Well, they're not in the room, but anyway, liver might be affected by viruses, mycotoxins, and so on and so forth, and that results in the elevated ALT because if the liver cells are damaged, then the enzyme goes into the blood flow, and you see an elevated ALT, and you can compare the ALT when you introduce a new batch of the feed at your farm. And this is important for a very simple reason. Liver damage will not be accompanied by an instant decrease or drop in the survival rate or the average daily gain. You might see oocytes, abdominal dropsy later on. Therefore, you have to monitor hepatitis infections to better understand when to use hepatoprotecting drugs. And you can either do pathology tests or biochemical tests. For instance, every 5 days, you get a blood test from the relevant hands. You monitor the dynamics after freezing, or you can do the breakdown by age for several hen houses. The same holds true for magnesium and zinc. These are the substances that are not produced indigenously; they are absorbed. Therefore, if you see a sharp drop in the zinc or magnesium, it might mean that this is a reovirus, and it damages the intestine. Then it will affect liver, and your mortality rates will go up. It might also result in additional reovirus-associated problems, and so on and so forth. Triglycerides, it's a more complicated issue, but it's a fatty liver disease marker. For layers, it might be a problem because they uptake lots of lipids. Cholesterol is synthesized by liver, and along with albumin, it might show you the integrity of the liver. Gout, and so on and so forth. Calcium is yet another important thing. Calcium cannot be assessed in a single test because of homeostasis. And that means that you might not see the problems. However, if you analyze 20 samples from the very same hen house, you'll see that there are deviations, for instance, an elevated level of calcium, and that means that sooner you will see above the norm values. Chlorine correlates with the fever, and if you do biochemical monitoring with the help of the chlorine in the blood, you can assess the starting point of the contact of the livestock with the pathogen. At one of the farms, I saw vets measuring the temperature to understand what was happening at the farm. And well, we're all vets. We should be able to drive the message home to make the farm manager buy the drugs that you want to sell to him or her. So how do we interpret the data? You can you can average it out for the hen houses. The variation coefficient in the serology assays is important, and in the population biochemistry, it is also important. Certain biochemical results show that homeostasis is already affected, and that means that the average temperature might be normal within the norm, but the mortality goes up, and you see the outbreak of a fever at a farm. The same holds true for these results. What we use in practice is we calculate correlations between various parameters. That's very valuable and interesting, because if there is a correlation, that means that there is a common pathway that affects the health status. The more money you have, the more girls you might date. That's a positive correlation, if you will. And I just wanted to show this example for you to show the relevant association correlation. Another correlation, another negative correlation would be the more money you have, the sooner you're going to be imprisoned. And this is a diagnostically relevant parameter. If chlorine correlates with zinc, for instance, it might lead you to a conclusion that the intestine is affected and this is a malabsorption. So it's not the polysaccharides, starch polysaccharides, but rather an inflammation process. Well, I guess you can read it at your spare time, and all these things can be calculated. You might find calculators online, just type in into an Excel spreadsheet your data and you will get the results. And if you can associate the titer with the survival rates, that might come helpful. For instance, the antibody level data could be input into a spreadsheet, and you will see a correlation with the quality of the vaccination and the survival rate. For instance, that's the good correlation, a bad correlation, and so on and so forth. And you can compare the correlation for different diseases. Some poultry farms already do that, and that helps them to get better results. It's not always that you can understand what vaccine is problematic, what vaccine leads to additional problems, and this statistical analysis of the big data, if you will, might come helpful both in biochemical tests and serum tests. For instance, the triglyceride drop might mean that the kidneys are affected. And there is a certain correlation between triglycerides and magnesium. The lipids and magnesium drop. Well, these are different things, but if there is a correlation between them, then that probably means that an internal organ that metabolizes both of them is damaged. The same holds true for the uric acid and triglycerides. And what I'm saying, well, I'm almost out of time, so you can download my PPT stack and take a closer look at it. In other words, we monitor the dynamics for hen houses. And then we develop the vaccination program or optimize the vaccination time frame. And this is the end of this is almost the end of the first session of the day, and now we're going to take a break. I'm going to skip these slides, and we can keep on discussing things offline, and we don't want to provide you with too much information. That's why I decided to shorten my report. And just a brief announcement, if you don't mind. Our South Korean counterparts will deliver their presentation during the lunch break. That's for those who are following us in Zoom. The title of their presentation is Productivity and Survival Rate Preservation through Vaccination Against the Newcastle disease and the avian influenza. Chong Jae-soo, CEO of KBNP, will deliver his presentation. I hope our South Korean counterparts are online. And if you have any questions for me, please shoot. Yes, we do. I have the following question. Actually, it's not a question, it's rather a comment. Since you already mentioned the 10 serum assay, I just wanted to clarify something. The statistical parameters show that 10 samples from annual poultry stock give you a statistically insignificant result, statistically wrong result. For instance, the spearmine table shows that you need at least 25 samples from the poultry stock. And the 25 tests will show you statistically significant results. If you, that's for 1,000 birds in a hen house. However, the 10 test assay will not be statistically significant for 1,000 birds in the same hen house. Well, that depends on your needs. If you want to do vaccination or inoculation, you need data on the titer. If you are doing screening tests, then much would depend on the infection level in your livestock. For instance, if the salmonella infection is 80%, then you will probably find it in the test results. However, if the pathogen did not affect over 1% of the stock before slaughter, then you will probably need to do 300 tests. Unfortunately, poultry farms accumulate enough serum samples and then send them to the lab. It's much better to send 300 samples right away than wait for the year end to understand what is happening. And the infected rate might be 15%. Our South Korean counterparts are online, I guess. So I suggest we give the floor over to them.